Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about facet joint syndrome. Every level of the spine has two facet joints. They're about the size of a thumbnail. They have cartilage just like other mobile joints. And together they allow all of us an impressive range of motion every time we bend, twist, flex, extend the spine. Even though they're small, they can be a tremendous source of pain. And that's when it's called facet joint syndrome. Facet joint arthritis starts in the disc itself. So here you see a cartoon. You have a nice healthy looking disc. This one has started to degenerate. It's losing some height as it loses water. That shifts pressure to the back of the spine. And you see these facet joints here in the back of the spine are starting to get bony overgrowth. And then the red refers to inflammation. But that's what an arthritic joint will look like. Why is facet arthritis more complicated than hip or knee arthritis? Well, we don't have an effective facet replacement like we do for the hip or the knee. It's because it's a complicated joint. There are two facet joints at every spinal level, and usually you have multiple affected with arthritis. So you only have two knees, you have two hips, but you have over 40 facet joints. They're small, and even though they're small, they can produce a ton of pain or none at all. Most commonly, facet joint syndrome develops from just wear and tear, good old osteoarthritis. It can also occur post-traumatic from something like whiplash. Whiplash is thought to cause harm to the neck facet joints, and that can lead to cartilage degradation that accelerates afterwards. And there's a lot of genetics that we don't understand as to why people get it and others don't. How is the problem diagnosed? History and physical exam, x-rays can be highly suggestive, but as remember, patients can be completely asymptomatic and have severe osteoarthritis at one level. Interventional procedures can help in a diagnostic way. So here you have a medial branch block where the needle is going around the joint, and numbing medicine affects the medial branch nerve endings that supply sensation to the joint. So if that relieves pain, then diagnostically it means that that is a source of pain for the patient. A facet joint injection is similar to a medial branch block, but the needle actually goes into the joint itself, and steroid and numbing medicine is injected. All right, so what treatments are available for facet joint syndrome? Well, first and foremost, over-the-counter anti-inflammatories and Tylenol can be very effective. For short-term pain exacerbations, then opiates can be given. For long-term, it's not a good idea. And now we have prescription pain creams that can be very beneficial as well. Physical therapy and chiropractic treatment. TENS units can help tremendously. For neck arthritis, over-the-counter decompression can help. And then spinal decompression therapy, you see a little bit of that here, is actually computerized intermittent traction that can be very effective for facet syndrome. Interventional treatments, I mentioned the medial branch block. Here you actually see a nerve root coming out from the spine. And then the little nerve endings that go up and down are called the medial branches, and this is a joint. So they're providing sensation to the joint. If you do a medial branch block, it actually numbs up those nerves above and below, and it can relieve pain over 80% of the time. You can also do an injection right into the joint, and I'll show you that right here. And that can relieve pain also about 80% of the time. For about 15, 16 weeks is the average. If those work and then wear off, they can be repeated, or a person can go on to have a radiofrequency ablation, which is when a catheter-type needle is placed around the joint, heated up and deadens those little nerve endings, and that can provide pain relief anywhere from 6 months to 24 months. It's really been a revolutionary procedure. So here you see some more statistics. Medial branch block, 85% effective for 3 to 4 months. Radiofrequency ablation, 80% effective for 6 to 18 months. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options to help patients achieve pain relief and avoid surgery with the board-certified doctors. Visit us online at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.